It's an email that has a lot of you still talking and asking questions tonight.
Yesterday, we told you Cleveland Clinic sent out a notice. Starting June 1st, it would require copays to be paid up front for non-emergency services, or your visit would be rescheduled.
We've heard from so many of you in the last 24 hours. News 5's John Kosick is following through on this story, looking for answers.
If you're a patient of the Cleveland Clinic, you likely received this email Tuesday alerting you to a change in hospital policy when it comes to copays. That's the amount of money requested up front for the patient's share of a covered service. Beginning June 1st, the clinic announcing those payments will be required up front for non-emergency outpatient services. If you don't have it, your visit will be rescheduled or canceled. In response to our story, we heard from so many of you voicing your concerns through email and on Facebook. Folks like Linda.
It was a shock because it's like one of those things that we've always done it this way. And suddenly, with about 2.5 weeks of notice, patients from who knows everywhere come to the Cleveland Clinic. There's going to be a change whether they can prepare for it or not.
Now, Linda has a Medicare supplement. In fact, we heard from a number of you on Medicare asking if the clinic is willing to make a policy exception for Medicaid, which they told us Tuesday they are. What about Medicare? We've reached out for the answers to that and other questions. The clinic telling News 5 something new. The patients with traditional Medicare are not impacted by this change, but those with a Medicare Advantage may have a copay depending on their specific Advantage plan. Reaching out to the clinic CEO directly with this letter asking him to reconsider the change as a whole was community activist Cassandra McDonald.
He's actually going backwards in delivering health care.
She argues what you make up in paid copays, you'll lose elsewhere.
They're going to be going to an emergency room instead of going to a primary care physician or a specialist or someone who can meet their needs on a continuous basis.
To be clear, not all were critical of the clinic's move. Alicia said if you take your car to a mechanic, you have to pay when services are rendered. So why is this any different? Jesse asking, so all this time paying was an option? They ask for the copay and I pay it. Been that way forever. Expecting to see more patients as a result are the folks at the Charitable Healthcare Network, which provides several free clinics across Northeast Ohio. They say they understand what the clinic is attempting to do with this policy.
However, when you look at it, it's got the opportunity to add some barriers to care. And, when there's a barrier to care, that means reduced access. And then that also means more patients may come and see the free clinics and the charitable clinics of the world.
A need they say they will be prepared to meet. If you have questions or concerns, reach out so we can help you get answers. In Cleveland, John Kosick, News 5.